and all, and I hope you're all set. Okay, set to give exam. Okay, what to be done this 10 days? I'll be discussing now. Okay, important things, what you need to make a note and everything. I'll be discussing now. So, but you are mentally prepared to give exam. Okay, so I don't want to discuss about the consequences and all these things, but let's focus more on giving exam and revising the things what you have listed to revise. Okay, right? So you need to do the revision. So in this 10 days, which are listed in front of you, hope I'm audible and visible to you, right? Screen is visible to you. So in this 10 days, your utmost focus should be on revision only. Revision means revisiting the same thing, redoing the same thing what you have done in the last 1 to 2 months, particularly because as NEET has been extended. Okay, so what we have done is we have done the one more round of revision. So what you have done in that one more round of revision, you need to recollect and you need to revise them. Okay, so it is revision. Okay, and if you ask me, sir, shall I learn new things? My open answer is almost no. Okay, my open answer is almost no. So your 90 to 95% of your time in the next 10 days should be on redoing the same things. And the leftover 10 to 5% of time, unnecessarily something will come in front of you. Okay, I said like, this is a new classification to be done. Okay, last year the question was given by, no, you have done 2023, have done all the things, but not completely accurate. Maybe you may be 90-95% is accurate. Suddenly you see a question, your friend is telling this is a last year repeat and you don't know it, you're doing it. Okay, you don't know it. Unfortunately, you have not done it. Unfortunately, you are not clear with that concept. So that is also a new thing. Okay. So that new things will be 5 to 10%. I hope this is very, very clear. Okay. The things what you need to focus in this 10 days is 90 to 95% of your time, or 90 to 95% of your time should be on revision. 5 to 10% of time you can give for unknown things, new things, which you suddenly don't intentionally do the unknown things. For example, I'm giving a good example. For example, an individual is not done with pharmacology, not at all done with pharmacology. Okay. Or an individual is not at all done with a particular segment of pharmacology. For example, a chemotherapy of pharmacology was not done. It is completely new. So don't do anything new. Even if it is very, very important, don't do new, because if you want to do new things will take more time. When things are taking more time, then you are not smart in the last 10 days. It's clear, right? So you're not done with a particular subject, you're not done with a particular topic. Okay, and you check your scores, you're not so confident, then it is not at all suggested to do new things by keeping more time. Okay, so I want you to give 90 to 95% of your time for revision and 5 to 10% of your time to learn new and unknown things. Okay, clear? I hope this is very, very clear. So this is the first thing I want to stress on. So what are the primary things? Okay, must do things, must do in the last 10 days. You have 10 days towards the exam. So must do things in the last 10 days to get a better result. The result should be better. It's not about what you have done in the last 10 days. It is about what is the outcome of your exam. Okay, last 10 days to get a better result, to get a better confidence, to get a better rank. So these are the primary goals in the last 10 days. For these two, for you to attain these things, okay, the first thing is you should focus on more on your reading. You should focus more on reading. Okay, what I mean is, don't analyze giving a mock exam. Okay, you give a mock exam, your score was around like 500, 550. Previous mock, you got 600 marks. Okay, now don't try to analyze that. Why 600 previous, now why 550? Because the stage of analysis, the stage of rectifying the things, the stage of learning from the mistakes is over. It's over. Okay, last 10 days also you cannot analyze the each and every question paper, each and every question. That is not done. Okay, that's not fair. Okay, so you should focus only on reading. Reading means you should give more importance to content, not MCQs. It doesn't mean I'm not telling you to not to do MCQs. You have to do MCQs, but you have to give most of your time on content reading, synopsis reading, quick revision, notes, whatever you have marked, whatever you have highlighted, whatever you have underlined, whatever you are prepared to revise. Focus on that, not on MCQs. Okay, the MCQs game is over. In the last 2 months, yes, you have to do more MCQs, but not in the last 10 days. In the last 10 days, you should focus on revisiting the things which are done by you. Okay. So the must do thing in the last 10 days is focus on reading, focus on revision, focus on yourself. Okay. You don't check what your friend is doing. You don't check how many marks your friend has got. Maybe some of your friends may be giving some mock exams. Okay. So, or grand exams. Grand exams are mock exams. Suddenly they will ping you. Suddenly they will call you. Okay. Suddenly hey, I have given this 18th mock exam. Have you given it? How many marks you got? What is the point? What is the point? Your marks in the final exam are important. Your performance in the final exam is important, not in 18th or 19th grand exam. It's okay. Even if you're not done with few grand exams, maybe you're done with 15 out of 20, it's okay, no problem. Be perfect with those 15. Be clear with those 15. So I want you to focus more on yourself. I want you to focus more on reading the content rather than doing the MCQs. I want you to focus more on revising the content rather than learning the things. These are the must 3 do things in the last 10 days. Guys, are you clear? I want your response on the chat box. Okay. Okay, 3 mandatory things is reading more, reading the synopsis more, reading the notes more, reading your MCQs. Even if you're doing an MCQ of your pro live, or even if you're doing an MCQ of your offline paper, okay, offline paper, or if you're doing an MCQ, read it, don't solve it. Okay, because solving stage we have already crossed. There is no point of sitting, thinking, solving, coming out with an answer, reading expression. No, read it, read the MCQs. Okay, solving we have started, we have done. So reading is more important than solving the MCQs. Okay, then revision is more important, second one, rather than doing the new content. Okay, new content, sometimes it comes, learn it, learn and move on. And focus only on yourself, only on your preparation. What you are reading, focus on it. Don't compare with your friends, don't compare with your seniors, don't compare with your, with your mates who are sitting with you, reading with you either in the offline center or you're reading together on the group. No, that's not at all advised. Okay, so these are the main important things I want you to focus. 3 important things I want you to focus as of now. Okay, right? Now the next one is, okay, the next one is your final exam is being splitted into 2 parts. Okay, so part A and part B. Part B is more of a dental questions. Part A is also having dental questions. Part A is also having dental questions, but it's more of a medical papers. Medical questions. Definitely, from a general student point of view, in general, I'm talking. Definitely, part A is going to be more tough than part B in general. But if your reading and revisions are proper, I see students coming out and telling part A is more easy because part A, most of the things will be on most common topics. Okay, for example, if you're talking about respiratory system, okay, or if you're talking about renal system, we know what are the most important things. Okay, nephrotic syndrome, or coming to the respiratory system, lung volumes, lung capacitance from physiology, or your oxygen dissociation curve, carbon dioxide dissociation curve from physiology, followed by if you're talking about medicine. Okay, so most of your questions will be moving around asthma or COPD or emphysema or bronchial carcinoma. Okay, or treatments of these things, or maybe on TB. Okay, so these are the common things. Most of your questions in part A will be on common things, very common things. Whereas part B questions, yes, definitely they will also move around common things, but some bouncers may come which are important for dental student ranking. Okay, so bouncers will come. For example, like you talk about prosthetics. Definitely, you have a high chances you have a question on finish lines of FPD, or you have a question on phonetics, or you have a question on major connectors, or you have a question, one or two questions on exclusively on the steps what you do in complete denture in your at a BDS level. Okay, right? Or you will have a definitely 2 to 3 questions moving on implant or implants. Okay, one question may be tough, but other questions can be easy, right? So this is a rough analysis. Okay, so don't get panic. Part A or part B, this to do, that to do. No. Okay, so everything is going to be comfortable for you. Trust the process. Trust your preparation. Okay, and just move ahead. Okay, so don't rely morely on social media. Okay, on the things which get circulated, which are coming as a suggestion. Okay, so please don't stay away from the social media. Okay, still there are few students messaging me about the postponement of exam, about this and that. It is waste of time. Why? If I ask them why, because someone is posting, someone is talking it on social media. Okay, so my suggestion, we are at last 10 days, let it be whatever it is going to be. It's a decision of NBE. Okay, but now, as of now, I want you to focus on preparation. Okay, right? So don't generalize the things whether to go with part A or part B. Whatever you feel comfortable at the time of exam, okay, you proceed with that. Don't prepare your mind before the exam that I need to go solve this first, come out, solve this next. I want to solve it in 2 rounds. I want to solve it in 3 rounds. Someone is telling on YouTube, who is a topper, who is a great teacher. Okay, so I'll do like this. Don't get prepared. I hope you're very, very clear like what I mean. Okay, so because most of you guys who are working from past 1 year odd, few of you from 6 months, let it be. Okay, and most of you have given n number of exams. Okay, let's check the mock folder. The mock folder is having 20 mock exams, 4 module exams. You have 3 or 4 grand examinations, and you have previous papers. So you have given lots of examinations in this pattern of 240 MCQs. So my suggestion is, then there is no point of taking a suggestion. Okay, if you're done with only 1 or 2 mock exams, or maybe 5 mock exams, then you require suggestions from the mentor. Okay, right? But once you're done with 20, 25, 30 mock examinations, there is no point of taking suggestion from any side. Whatever is comfortable for you, whatever you feel good, whatever is going to take you from the analysis of these mock exams, what you have done through the process, you just try to implement them. Okay, don't randomly predetermine your mind before going for exam. Okay, someone is telling to do part B first, then move to part A, half of the part A, half of the part B, half of the part A, half of the part B. Now someone is telling you to do in 3 rounds, round 1 this questions, round 2 that questions, round 2 this questions, revision again. Okay, no, diagrams one part. Stop this nonsense. Okay, let's do whatever that is comfortable for you, whatever you feel that is going to be good for you. Because as an Mdsconquer students, exposed to more number of examinations, and secondly, our WhatsApp activity, because you have the habit of reading the things fast. You have the habit of reading the things fast, which are on the screen of your phone or laptop. Okay, so that's an extra advantage. So I have never seen students coming out of the exam and telling that time is not sufficient. Okay, time is not a big deal for Conquer students, so don't worry. So whatever you feel comfortable, you go ahead and do it. Okay, so that is one important thing I want to stress on. And coming to I don't want to give any must-do topics or any checklist, because checklist topics we are discussing from long back. I hope in lots of live sessions we have discussed about the checklist, what to be done, how to be done, what pro-life student has to do, what offline student has to do. Okay, everything. But I'm going to talk about this must-do topics or must-do things. Let's consider as must-do things. Okay, one important aspect is in the must-do. If you are not clear what to be done, if not clear, don't feel bad. It doesn't mean that your preparation is not up to mark. Okay, your preparation is up to mark, but few of us are not cleared, because few of us we used to have a habit of just blindly following the mentor, because it's a guided based preparation with Mdsconquer. So you have a habit from the day one of Conquer, you have a habit of following the schedule or pattern or suggestion that is given by the mentor. So that's it's not a problem. Yeah. Okay. So good students know what to do, or bad students or people whose preparation is not up to mark, they don't know what to be done. Okay. So we don't have any such theories. So my suggestion is, if you're not clear what to be done, okay, if you're not clear, or if you're not confident what to be done, if you're not confident in the preparation, if you're not clear in the preparation, my suggestion, I want you to focus more on mocks, more on modules, more on repeats, at least the repeats available on the website. Because if you check out the mock exams, roughly we have 20 mock exams, each of 240 questions. So that turns around like 4,800, if I'm not great in the calculations, but okay, I can manage. And next 4 module exams, each of 240, like turns around like 1,000 MCQs. And you have repeats from 2018 to 2023. That is, 18 is 1, 19 2, 20, 21, 22, 23. 6 papers. 6 into 240 turns around 1,500. Roughly, I'm giving. So 5, 6, 7. You have 7,000 plus MCQs only on the mock. More than that. In fact, like you may be having some 8 or 8,000. Okay. So this is the best mode of revision. Okay. This is the best mode of revision. If you're not clear, what to be done, my suggestion is focus more on these things. Along with these things, if you have access to quick revision videos is more often like storytelling. Just watch it. If you feel like, okay, I'm talking about endo, you have opened, and we are talking about endo, and you see Ellis classification I'm discussing, you are familiar with Ellis classification, skip it. Okay. So now you're not clear with Anderson's classification, see it. Menton's classification of C-shaped canal, see it. Okay. Kim's classification of periapical surgery, not clear, watch it. Okay. So whatever you're not clear, not confident, watch it. Whatever you are clear, skip it. This is the revision. This is revision. It doesn't mean I'm asking you to check the quick revision, means doesn't mean to check top to bottom of the quick revision. Okay. I hope this is very clear. Okay. So I want you to focus more on these aspects. And the second category of students, if you're clear, the second category is, if you're clear, I hope you have already started the journey. Okay, right? So I was telling you from the day one of the year, let's prepare for the last 10 days. And I know that most of you are prepared for the last 10 days. Do according to your plan. Okay, no suggestions from my side. Do according to your plan. You guys are doing good. All of you are doing good. So there is no extra suggestions from my side. But my recommendation is, don't miss this. Okay, don't miss them. These are not must do. If I am a student, I'm not talking as a mentor. Okay. If I am a student, I don't want to miss these things. I will do this. I have done this during my preparation. I made all my students in the last 9 to 10 years to do the same. And I made you to do the same when you're giving INI CET also. Okay, right? So INI CET also, right? So I'll be telling this first year subjects. General anatomy. Please do dental pulse synopsis. Okay, dental pulse synopsis. Make sure check diagrams. Diagrams wherever required. Osteology. How do I identify a foramen? How do I identify muscles of mastication? How do I identify the branches of facial nerve? Okay, right? So diagrams are important. So then the second subject, along with general anatomy, you have general histology. General histology, I want you to focus on the examples of epitheliums and diagrams of epitheliums, right? Then focus on general embryology. Must do. Okay. Pharyngeal arches, pharyngeal pouches, development of face, palate, tongue, lip. Must do. Must do. I don't want you to skip. So this is the first subject. So we're done with the first subject. Make sure you should do these things. Okay. Levels of lymph node. Okay, you see levels of lymph nodes. Make sure, okay, you do the basic anatomy of liver, lung, kidney, heart, ear, eye, muscles of eyeball. These are basics. Okay, right? These are basics. Okay, please try to do it. So then jumping into the second subject. Okay, so that is your biochemistry. Biochemistry, I want you to focus on dental pulse synopsis or PP book synopsis. Both very good. Wonderful. In this, I want you to focus more on vitamins. Check out the vitamins, daily requirement of vitamins. Normally, deficiency and all these things, I hope you can manage. I want you to check the enzymes, lipid profiles. All the classifications related to the biochemistry were covered in your PP books. Please try to do the memory-based questions. Plus, I want you to focus more on rate-limiting enzymes. Okay, right. So jumping into biochemistry is not going to eat much of your time during the revision process. So then jumping into the next subject is physiology. I want you to focus more on dental pulse synopsis. Don't miss it. Don't miss it. That's what my suggestion is. Whatever I'm telling is not must do. I'm telling not to miss them. Okay. Nothing more than that. Then the fourth one is dental anatomy. Again, dental pulse synopsis. Very good. Next, fifth, dental histology. Again, dental pulse synopsis. Plus, do histology diagrams. Because last year NEET also they have given histology diagram. Then color plates of velars. Particularly, I want you to focus more on permanent dentition. I want you to focus more on permanent dentition. With which I am done with all the first year subjects. Then jumping into the second year subjects. Do let me know if I miss anything. I'm not prepared for this. I don't have anything in front of you. I'm telling if I am a student in these 10 days, these are the things I will do. Okay, with my 2 years of reading experience and 10 years of teaching experience, considering myself as a student, I don't want to miss them. So then jumping into the next subject, second year subjects, pharmacology. So I'll be splitting the pharmacology into general pharmacology and dental pharmacology. So in dental pharmacology, I'll be focusing on top to bottom of LAs. I hope you are familiar, calculations of LAs and everything. So general anesthesia, we may not be familiar. So please spend more time with general anesthesia, particularly stages of anesthesia, conscious sedation, okay, particularly nitrous oxide, stages of anesthesia, and all those gases and their peculiar points, where to be given, how to be given, and everything. Okay, then I want you to focus more on right pin index values, color codings, color of the cylinders, and all these things from GA. And then I want you to focus on chemotherapy, particularly tetracyclines, cephalosporins, penicillins, anti-TB drugs, anti-malaria drugs, anti-cancer drugs. Of course, amino glycosides and all these things, everything top to bottom, which are very important for dentistry has to be. Then comes the emergency drugs of dentistry. Medical emergencies of dentistry has to be done. Okay. Then the other important topic of is drug interactions. Drug interactions. Dental drug interactions has to be done. Okay, right? Okay, so coming to general pharmacology, first chapter of general pharmacology is important, top to bottom. Particularly your phases of clinical trials, levels of clinical trials, what are drug inducers, and all those things. First order kinetics, second order, zero order kinetics. Okay, all those things has to be done thoroughly. Then for every system, you guys has to be clear about the main classification. For example, like you're talking about the renal drugs, you should be very, very clear about the diuretics. Okay, you should be very, very clear about the diuretics. Or whenever you're talking about GIT, so you should be very, very clear about the proton pump inhibitors. Or you're talking about the respiratory system. Okay, you should be very, very clear about antihistamines. Very important. Okay, every year you're encountered with a question on that. So apart from this, pharmacology drugs of choice are important. So lots of drug choice based questions were discussed on your activities, both in the Telegram as well as in the WhatsApp. Okay, so those are the best mode. Again, in this 10 days, you'll be constantly get exposed to most of the drug of choice based questions. Okay, so drug of choice based questions, adverse effect based questions, okay, or a particular drug in a particular condition is important. For example, you're talking about tetracyclines. Which of the following tetracycline can be given in the renal failure? Okay, so that is a particular condition, a particular drug has to be given. So such questions also they can ask you. Okay, so that is about pharmacology. So then jumping into microbiology. I want you to stick on to your notes as what you have prepared, particularly sterilization, basics, all basics. Okay. And immunoglobulins are very important areas. Hypersensitivities are very important areas. If you're not clear, then go back and check it. For example, sterilization, I'm very clear. Immunoglobulins, I'm very clear. Hypersensitivities, I'm very clear. So I don't want to revise them. But these are important. You'll have one question on each of these topics. So I feel like I'm not very clear with bacteriology. So what I'm going to do, I'm going to spend some extra time with bacteriology. Particularly, you have a very important bacteria, right? TB is important. You have Streptococcus important, Staphylococcus important, Pneumococcus is important, H. pylori is important. Okay. Diphtheria is important. Syphilis is important. Okay. You have syphilis is important. TB is important. Leprosy is important. So I don't want to waste my time on unimportant things. I'll be checking all the important things. Okay. What is the test to be done? How to identify on a particular agar? Okay. Yeah, what are gram positive, what are gram negative, what is CAMP, and all these things I'll try to have a glance, because definitely I'm not a microbiologist, so there is a high chance that I'll definitely lead to confusion. So then comes the second important is virus. Virus, I'll be focusing on HIV markers, as well as I'll be focusing on hepatitis B markers. A little bit of COVID-19 I'll be checking, and herpes simplex virus, Epstein-Barr virus, cytomegalovirus are important things to be done. Okay. Then fungus, maybe I'll be focusing on candidiasis and mucormycosis, maybe a little bit of about each and every other fungus. And coming to parasitology, I'll be focusing on malaria. I'll be focusing on Entamoeba histolytica, maybe Taenia solium, a little bit about Taenia solium or Ocularia bancrofti. Okay, so maybe, but more often malaria and Entamoeba histolytica, because even if you check out the last 2023, you have a question on Entamoeba histolytica. Okay, right. So then jumping into general path. General path, all the basics, like I hope you can handle all those things, like the necrosis, different types of necrosis and their examples, apoptosis, anti-apoptotic genes, apoptotic promoting genes, maybe a little bit about your complement system. Okay, I hope you are very familiar with those things. Or like you talk about gangrenes, different types of gangrenes and their examples, different types of calcifications, what is difference between metastatic and dystrophic calcification, thrombi, inflammation, steps in inflammation, steps in edema formation, and all these things are very raw basics. Maybe memory based aspect, I want you to focus on genetics. So genetics, you need to spend some time. What are the syndromes, or what are the conditions? Autosomal recessive, autosomal dominant, X-linked recessive, and all these things. Examples are very, very important. And I want you to check out the pedigree charts. So how to solve a pedigree chart is again an important area that the questions can come from. Okay. Then jumping into the next subject is DM. DM, I want you to focus on dental pulse synopsis. Enough. Okay, with a little bit of repeats, is more than sufficient. Okay, right? So then jumping into the third year subjects, general medicine. General medicine, you don't have a proper background, so that is the reason why I want you to do. If you have time, I want you to focus on doing the main things, main diseases, or main things in each system. General surgery, I want you to focus more on thyroid carcinomas, more on thyroid. What is hypothyroid? What is hyperthyroid? Different types of thyroid abnormalities. What is thyroid storm? And all these things. What are the drugs of choice and everything? I want you to focus on ulcers. I want you to focus on burns, a little bit about lower limb, particularly venous disorders, arterial disorders. The oral path, again, I want you to focus on dental pulse synopsis with oral pathology histological slides of important diseases or important pathologies. For example, like you're talking about cysts. Okay, so I want you to check radicular cyst. I want you to check OKC. Okay, both. I mean, radiographically, histologically, and the clinical. Okay, because if they want to give a question on a pathology, they'll be asking questions on the most common pathologies. Most common pathologies they'll be asking. Okay, right. So I want you to check most common pathologies in everything. Okay, particularly dental pulse synopsis. Then jumping into fourth year subjects, oral medicine is done with oral pathology. So radiology, I want you to focus on synopsis of dental pulse. Okay. Uh, then pedo, maybe a little bit about the tables which were given in your PP books about child psychology. A little bit about PP books I want you to do. Maybe milestones, PP books tables has to be done. Same ortho. Also, I want you to stick on to the same thing, PP books, because you don't have great synopsis part in your dental pulse. Okay, so I want you to stick on to power play books. Even for oral medicine radiology, if you're all if you're previously done with PP books, PP books is a good source of revision. So then perio. Perio, I want you to focus on quick revision aspects of perio. Don't miss the suturing techniques. Don't miss the sutures. Don't miss the instrumentation, instruments and instrumentation. Okay, again, here also, I strongly recommend you to do the PP books if you're already done. Okay, if you're not done, don't touch it. If you're already done, it's good source to do the revision properly. Then comes the second part, community. Quick revision is the best option. Quick revision videos. Or else, if you have PP books, you're done with PP books previously, they're good source of revision. Make sure TOS has to be done properly, tests of significance. Sampling techniques has to be done properly, and followed by indices has to be revised properly. And I want you to focus more on fluorides. Fluorides has to be done, must do, don't miss them. Pakka, you'll be having questions on this series. Then after community and talking about oral surgery, I want you to focus more on fractures. Okay, let's focus more on fractures, and maybe quick revision video is going to help you. Pulse synopsis is too vast. I don't think pulse synopsis is going to have a great order in the last 10 days, but I want you to focus more on fractures and most common things. Don't miss them. Fractures, don't miss them. Okay, and quick revision video, don't miss it. So then comes prosthetics, dental pulse synopsis, 20 endo, quick revision. quick revision plus PP books. Good source to revise. Cons, quick revision plus PP books. Good source to revise. Implants, PP books. Good source to revise. Forensic odontology, PP books. Good source to revise. Have I missed any subject? Have I missed any subject? Ortho is done. Ortho is done. PP books are the good source of revision. Done? I'm done with all subjects, right? Okay, don't miss these things. Okay, these are not must-do things. If you have already done these things, don't miss these things. These are the good source of revising those areas. Prostho is done. Prostho, dental pulse synopsis. Okay, right. So make sure in the revision, in the last 10 days revision, you should give more priority. You should give more priority to memory-based aspects. Okay. So memory-based aspects, what priority has to be given is more priority to the memory-based aspects, particularly classifications. Okay. Because I feel classifications are memory-based. And similarly, you have tables. Okay. You're going to have tables, right? When you're talking about heart sounds, example I'm giving, heart sounds, first heart sound. So the explanation of first, second, all these heart sounds is a table. Murmurs is a table. Okay, right? If you're talking about clasps, different types of clasps used in prostho, which are given in the explanation part, is a table again. Okay, so most of these are tables. Okay, so a revision of revision of tables and revision of the explanation parts. I mean, particularly the classifications and all these things, make sure keep it as a priority. So when you're checking like endo, you have more classifications. When you're checking like DM, you have more classifications. Like operative dentistry is going to have more classifications. Okay, right? So talking about community, indices are important, memory based, solidly they are memory based. Okay, so give more time to such areas, memory based aspects. So indices, you have to read it properly. Okay, prosthetics, when I'm talking about RPD. Okay, so your major connectors, questions are high chances of questions are coming. This is a completely memory based, so you need to learn them. Clasps, you need to learn them. Finish lines is a table, you can manage, so you can skip it. Phonetics is a table, you can manage, you can skip it. Okay, so this is how you need to be smart. Okay, topics where you're confident, you need to skip them. Okay, so don't come out with a mindset that okay, I need to see everything, I need to revise everything. No, if you want to see everything, if you want to revise everything, we may not touch 22 or 23 subjects what we have discussed. We can hit up to 12 or 15. So we need to get compromised completely in 5 to 6 subjects, which is not at all a right advice. So being smart in the last 10 days is touching all the subjects. It doesn't mean touching all the topics or all the subtopics of all the subjects. Touching all the subjects, touching the topics which you are not confident, touching the topics which requires a look, which requires a revision. Okay, right. For example, I want to check out a particular classification. Okay, I want to read a particular classification. I want to see. Okay, I'm a little bit confused about this class 3 and class 4. Okay, I'll check those. Jump. But a particular classification which I feel like I need to go and spend some time, like maybe 4 or 5 minutes. Okay, so that is completely your judgment. Okay, like if you feel like you want to do offline papers as a source of revision, because I told you, right, there are few students keeping a revision of a particular thing only exclusively focusing on offline papers, or exclusively focusing on pro live papers. Yes, that's a good choice, because whatever I have stressed out, for example, like I'm talking about endo quick revision. The endo quick revision is already included in your pro live papers. Endo quick revision is already included in your offline papers. Okay. Or for example, cons quick revision plus PP books. Yes, cons quick revision plus PP books is already covered in offline papers. So it is your wish. Okay. You want to stick on to a particular thing, that is your game. If you're not clear, then I want you to shift to this particular things. Focus on more on these things. Okay. And that's what I'm telling. I'm not giving a suggestion. I am telling, don't skip these things. Don't skip these things. Most of the things what I have stressed out here are memory based things. Here are classification based things. Here are tables. Okay. So my point is, these are not must do. These are not to be missed. I hope it's very, very clear, right? Okay. Right. So the main aspect why I have initiated this live session was done from my side. Okay. So before closing the session, my suggestion for all of you is, don't over exaggerate your preparation. Okay. I see like there are many good students in the last 8 to 9 years of Mdsconquer, including me. I'm also a better student. Okay. Including me, I'm also a better student. Most of the good students, okay, have spoiled the exam, including me. Okay, I have also done my best during my preparation. But if you check out my ranking to the knowledge I have, or to the efforts I kept during the preparation phase, it was not properly reciprocated, because I am over exaggerated. Okay, I'm over exaggerated, unnecessary aspects, wasting my time on unnecessary aspects. Like for example, if I have a doubt, what I used to do is, during my preparation phase, if I have a doubt, my mind is so like, I don't know why I used to think like that. So I was more involved to message my mentors, 3 or 4 mentors, seniors. I used to have 2 or 3 groups in which I posted, discuss it. I don't know why I wasted my valuable time of revision in the last 1 month on doubt solving. I used to help in solving the doubts of others. I used to waste my time on solving my doubts. And finally, those doubts which I have discussed in my last 1 month of the preparation time during 10 years back were same doubts till the date, because they are controversial questions. Okay. So there is no point. It's waste of time. Okay. It's waste of time. At the end of, after 10 years with my experience, what I can tell you is, whatever I have done during my preparation in those days, in the last 1 month, is really waste of time. Okay. It's really waste of time. Why I have wasted this? I don't have an answer at that time, but now I have an answer. Okay. So these are like over exaggerated students. If it comes, what happens? Okay. So I'll tell the answer is this could be the better answer. Sir, if both are given, why he will give both? How much probability is there for a question to come, and how much probability is there for a paper setter to give both the options? Okay, both B and C are correct. Okay, learn and move on. If both are given, what is the answer? What is the answer? No one knows. Point is, no one knows, because do you know, guys, that NEET is not going to release the question paper out? You know this, right? Yes or no? NEET is not going to release the question paper out. INICET is not going to release the question paper out. Be clear. It's not MSET. 11th and 12th standard story is different. Okay. Second thing, NEET and INICET not going to release the key out. No key also. No question paper, no key. Okay. They will release only your marks and ranks. Okay. So, for example, you are fighting for something and coming out, and if they're giving the key, then we will know what is the outcome of this. Yes, you fought so hard and you are the winner. No, you fight for something, your answer is A. I fight for something, my answer is B. We don't know what is the final answer that is given by the NBE people. Okay, right? Okay, so then there is no point of wasting a time on a particular question, which is a question for everyone. Okay, so my point is, after 10 years, what I can tell you is, whenever I find a controversial question, I try to read the background of the question. For example, you have a controversial question on ameloblastoma. What I will do, I will try to read everything about ameloblastoma rather than wasting my time on fighting the answer, getting the answer for this bloody question. I'll open Shappers and I'll read entire ameloblastoma. That is simple, rather than wasting your time on a particular question. Okay. So that is one golden suggestion I want you to give. The second suggestion I want you to give is, don't think about the outcome. You see, Mahendra Singh Dhoni is the most coolest captain. I don't know whether he's a great captain or not. If you check out, he's the most coolest guy. Okay. And most coolest captain. You don't see that frustration on the face of Dhoni at any time in his lengthy phase of career. Even if you see Rohit Sharma is doing good, But you see the frustration. You see Kohli as a captain, you see the frustration on the face when things were not going good. And you check out Mahendra Singh Dhoni, okay? He's a very cool guy. And if you check out the World Cups, most of the World Cups where we have lost recently, many World Cups we have lost in the final. But Mahendra Singh Dhoni, because of his cool nature, of which what he has maintained in the team, there are many matches which we should lose, but we made it possible. You see one match like India versus Pakistan final of 2007 World Cup, T20 World Cup. Yes, there is a high chances we should lose that match. Why we won that match is just because of the presence of mind of the captain. Or like you check out, there are many matches in 2011 World Cup which we have to lose. Okay, but it is the presence of mind and the captain. Like you see, like one final match, we should lose it with Bangladesh. Okay, they need to hit some 2 or 3 runs, and Dhoni presence of mind has made it possible. Okay, so here the presence of mind is more important. Okay, this is a very simple exam. Don't over exaggerate yourself. Okay, to do this, to do that. What happens if I don't get this? Okay, leave about all these stories. Nonsense. This is all. Okay, nothing is going to happen. Even if you don't get a rank, let it be very clear. I mean, 2012. I have given the NEET examination, which the exam was cancelled after giving. Okay, you may have such results in your fine. 2013, I have given my exam. I got a seat. Okay, but I have a different plan. Okay, I have a different plan. So I have quitted the seat. Okay, right. So my motto is to get into government dental college. Okay, so again I have restarted the preparation after quitting a pedo seat in a private college. Then I have given an exam, targeting only for a GDC. So I have missed the GDC just by 1 mark. Okay, but finally I joined in the private college. That's what I'm telling. There's nothing to lose here. Okay, so sir, what happens if I don't get a GDC? Something will happen, yeah. Don't worry. Okay, something will happen. Don't. Oh, this is what I have done during my preparation. I got a seat A category. I have quitted it just to join a government dental college in the next year because I'm confident about that. Okay, I have done my best, but things are not possible on other side because God has a different plan to me. Okay, it's not about a GDC. More than a GDC, his plan is to give me a knowledge or give me a space of more than a GDC. So I entered into a college, into a department where everyone is supporting and made Mdsconquer possible this day. So if I am in GDC, there would be no Mdsconquer. Okay. As I am not in GDC, I have done Mdsconquer 9 batches. You're the 9th batch, and I have started the 10th batch also. I'm doing my life very, very good. Okay. Because God has a better plan in accommodating the things. I got married to my sub-junior. If I'm in GDC, I don't know this is going to happen, right? Okay. Now I got my life partner also in the same college, in the same department. I have the best mentors in the same department. I have best juniors in the same department. I have best seniors who used to help me in doing my things in the same department because that is God's plan. He's planning to give you more than GDC. So don't over-exaggerate. Sir, my parents will not allow if I don't get a GDC. I'm GDC. This GDC will kill you. Okay. Kill your mindset. Kill your question paper. Okay. Let's go. Give your best shot. You will be rewarded with more than a government dental college seat. That is the life of dentistry. So dentistry is beyond GDC. That's what I'm telling. Okay. If you are in GDC, you're stucking yourself. If you are working to be the best, you will be rewarded with more than GDC. Okay. So at least these 10 days, remove that bloody concept of getting into government dental college from your mind. Okay. And come out with a concept that these 10 days, I'm going to give the best to myself. Good quality of reading, good quality of building the confidence, good quality of spending quality of time with you. Who is going to help you? It's you. I'll tell stories, yeah. I'll tell so many stories. Okay, it's okay. If you want me to tell stories, I'll tell stories. But who is going to help you? The right person who is going to help you is you. You have to help yourself. I was not rewarded with a government dental college even after giving the exam for second time. Who helped me? Me. I was in a private college. I was not in a position to decide whether I need to start my journey with PG training or something. Who helped me? It's me. No one has helped me. It's me. Who has written the PP books? It's me. Who has typed the PP books? It's me. Who has printed the PP books? It's me. Even in the offline, or even if a pro live tomorrow, a pro live class is there, okay, if someone is not there, for example, my attender is not there, who is going to do the pro live paper editing? It's me. Okay, so the game is yours. It's always you who is going to help you out at any situation. Okay, don't expect someone to come out and help you and do magics. So GDC is just a tag. It's not going to change anything around you except the financial support that is going to given to you for the next 3 years. Okay, that's a benefit for GDC. But who is more important in the journey is it's you. Okay, so I don't want you to storm your brain, keep stress to your brain, keep anxiety to the brain. You need to get this, you need to get that. This exam I got 600. Next exam I should get more than 600. What is this logic? I don't understand. How can you get more than 600 in the next exam? The paper may be tough. Logicless, right? You always determine yourself. Okay, suddenly some bouncer is coming. Even if it is bouncer, I need to hit it 6. No, change the aspect. Okay, let's give your best examination. Magical examination should be on March 18. Okay, done. So these are the suggestions from my side. Maybe as you progress deep into your life, you will attain this maturity. Maybe after 5 years, you're going to motivate few other people as a mentor or as a teacher, as a professor in your respective colleges. Okay, but I think we can do this. Okay, even with the people with less maturity, less experience, can do this. I have seen I have seen many students. When I was talking to them, like I felt very sweet. Okay, I felt like how these guys at a little age have got this maturity. Like I was an intern, I was blind. Okay, I was blind. I don't know what I'm doing. I don't know for what I am doing. I used to waste my time on my friends, waste my time on XYZ factors. But you see a quality of 5 or 10 students in every college, they are more matured uh, compared to me. Now, after 10 years, if you see the maturity levels, they are doing good. Okay, it's really wonderful and sweet to meet such category of people every year. Okay, right. Uh, Right. So that is these are the few things which I felt like suggesting you. These are the must do. Okay. Right. Focus on more on a revision of the mocks, revision of modules, questions, and the relevant explanation part. If you're not very like if you're so confused like what to be done to get a good rank, my suggestion is mocks modules are very good source of revision because vast subject, very important areas were covered in those things. Okay, right. So those are suggestions from my side, and probably the recorded version I'll upload you on the YouTube channel and you can watch it. Study well, take care. I'll be with you, don't worry, I'll be with you. The main reason why I'm not coming to live is unnecessary discussions, unnecessary talks. It is something like if I go to live, I mean individual, I'm responding you on WhatsApp. So if I keep a live or if I go to offline, I feel like it is like taking a chewing gum and sticking to your hands. What happens if you take a chewing gum and stick to your hands? What happens? What happens? Right. So I don't want you to create that irritation. Okay, let's have and do well. Okay. Take care, study well. Bye bye. See you. Okay.